Welcome back. Week 4 of the NFL kicks off in just a few hours. But many fans and players alike are so in shock after Hall of Famer Brett Favre revealed he has a life-altering disease. It's something he blames on playing football.
I also lost an investment in a company that I believed was developing a breakthrough concussion drug I thought would help others. And I'm sure you'll understand why it's too late for me, because I've recently been diagnosed with Parkinson's. This is also a cause dear to my heart.
Now, that news from Favre led to the announcement of another former player announcing he's battling a separate degenerative brain disease. Both come after questions are being raised about the future of the current Miami Dolphins quarterback who suffered a concussion. Here with us are twin doctors, Idries and Jamil Abdur-Rahman. Doctors, welcome back. Great to see you.
Thanks for having us.
Dr. I'll start with you. Let's start with the players. How has science evolved to protect our favorite athletes and prevent brain injuries, and has it developed enough?
The short answer, no, it has not developed enough. What these people are suffering from is something called chronic traumatic encephalopathy. And so chronic meaning long-term, traumatic, trauma, pretty obvious, encephalopathy, swelling of the brain. It's basically a sick brain. And it's from constant trauma, constant hits. And so no, unfortunately, science has not developed to the point that we can actually prevent this or even do much to reduce its effects.
Dr. J, many American families, as you well know, have been affected by degenerative brain diseases. I do want to start with Parkinson's. Can you talk to us about the symptoms and the treatments out there?
Yeah, so typically the symptoms are going to be symptoms that involve movement, although when we think of Parkinson's, most people think of the tremor, and that's certainly one of the more common symptoms, but there's also going to be cognitive symptoms as well. And so oftentimes people with Parkinson's may feel forgetful. They have a hard time concentrating. You can see changes in sleeping patterns where someone's sleeping more than they did before, or they're sleeping less than they did before. You can also see changes in mood and affect. And so you may feel that they're moody or they're just not themselves. In terms of treatments, there are a lot of medications that basically work to downregulate the activity of the portions of the brain that are too active in Parkinson's. And they are even doing some treatments now that involve changing the effects of the circuitry or the electrical circuitry in the brain that is misfiring when you see a patient with Parkinson's disease. But to date, unfortunately, while we're able to improve the quality of life for a certain amount of time, you do still see that downward track as the disease progresses.
Dr. J, let me stick with you for a sec, because it's not just athletes who are being diagnosed with Parkinson's. But I have to ask, is playing contact sports really increasing your risk?
I would say playing contact sports absolutely increases your risk of not only Parkinson's, but a variety of degenerative diseases. And part of it comes down to inflammation, right? When you talk about most diseases in the body, it comes down to inflammation. Chronic head trauma causes inflammation. Inflammation basically causes proteins in the brain that normally function doing one thing to do something completely different. That causes brain cells not to function properly. It causes brain cells not to communicate properly. And it can lead to Parkinson's, but dementia, even things like anxiety and depression. And kind of like Dr. I was saying earlier, steps are being taken. We had these Guardian helmets in the NFL, for example, and they diminish some of the force being applied to the brain, but not by much, by about 10%. And so, these contact sports play a huge role.
Dr. I, this week, another big health announcement, this time from a beloved player from the former Minnesota quarterback, Tommy Kramer. He announced he has dementia. So is this another mental disorder that is increased by concussions?
Absolutely. So when we think of concussions, we think of something that happens acutely, right? But what happens is when you have this chronic trauma, which a lot of football players do, and not just football players, but rugby players, people in contact sports like this, you have this chronic inflammation like Dr. J was saying. So you get this deposition of these proteins in the brain, and overall you end up getting shrinking of the brain. That's what the encephalopathy is. And so, absolutely, we're going to see more Parkinson's, more dementia, more depression, more anxiety. You see a ton of mood disorders in people that have concussions frequently or CTE.
Thanks for watching, everybody. Go to joinnn.com to find NewsNation on your television provider. Also, don't forget to click that red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.